Fellow Kenyans, good afternoon. Over the last few months, we have focused our briefings mainly on COVID-19, and understandably so. We will continue to do that. However, we find it prudent to use this platform to also present to you with a picture of the medical landscape in Kenya as it relates to disease outbreaks. This is important because COVID-19 affects more so those with compromised immune systems and those with underlying conditions. We must also recognize that we are potentially exposed to diseases because of the ongoing rains and flooding in certain parts of the country. We had a cholera outbreak that started off in Garissa and gradually made its way through 3 other counties, namely Wajir, Turkana, and Murang'a, before being reported in Marsabit on the 24th of April 2020. The collaboration of the public health teams from the local county governments and the Ministry of Health is working to control the reported 550 cases, out of which 268 are in Marsabit, while 222 in Turkana County. It is unfortunate that we have also lost a total of 13 Kenyans from this cholera outbreak, 12 of them in Marsabit and 1 in Turkana. Regrettably, most of the cases, at least 40%, and sadly 70% of the deaths too, have been among children aged 10 years and below. May God comfort the bereaved families and rest in peace the souls of the departed. The other reported cases in Garissa, 48, Wajir, 4, and Murang'a, 8, have all been controlled. We are working closely with the county governments of Marsabit and Turkana and hope that this is fully contained over the next few weeks, at least in the next 2 weeks. We believe that this is feasible given the fact that the outbreak is currently localized to only 2 areas, which is Marsabit and Turkana. As it relates to COVID-19, we are noticing some interesting trends developing globally that you may wish to be aware of, particularly of those within the medical fraternity. As the virus continues to spread, the infected persons are increasingly exhibiting new, less typical, non-respiratory system symptoms such as sudden strokes in young people, and multi-system inflammatory symptoms with features similar to those of Kawasaki disease and toxic shock syndrome in children. These cases have largely been confined to the United States, the United Kingdom, France, Italy, and Spain, and have so far not been seen in Kenya. We nonetheless need to be cognizant of them because in each of these cases tested for antibodies, the results were positive, which indicate that the patients had been exposed to COVID-19. Beyond this, there is a growing number of patients exhibiting non-typical flu-like symptoms, such as gastrointestinal distress syndrome that leads to loss of appetite, nausea, vomiting, diarrhea, chickenpox-like lesions.